Hello and welcome to Homeopathy at Home with Melissa. Today I have a very special guest. I'm super excited to talk to Judyth Reichenberg-Ullman today. And we're going to talk about something that she has learned about some of her experiences. And I think we're going to call this episode Homeopathic Miracles. I love that. I do want to ask first, if it's okay, Judyth, how are you related to Dana Ullman?
No, of course, everybody asked me that. And it's ironic because my husband and I wrote 8 books on homeopathy, and Dana wrote who knows how many books on homeopathy. So I was on the Gary Null show, and even Gary Null said, "Hey, saw your husband in the airport. He looks really good." And it was the second Gary Null show I'd done. And it was the second time he thought Dana was my husband.
Oh, that's so
I
fun.
just said, "Thank you." Yeah, he does.
That's right. That's so funny because yes, I immediately thought this is Dana Ullman's wife.
Nope.
Well, I'm glad you're here. And you just told me before we actually started recording, you're in Washington and it's very cold there.
It is. It's burr. And I went swimming this morning at the gym and burr.
Yeah. Wow. Yeah. So I'm in North Carolina, very, very hot, and it's over 100 most days. It's
Wow.
very different. So I am so thankful that you wanted to come on here and share some of your homeopathic miracle stories. So I'm just going to let you take it away. And I think this will be encouraging to our listeners, that they'll just be, especially new people, that if they're new to homeopathy and they can hear encouraging stories of things of how it's worked. So tell us about it.
Sure. Well, I've been in practice since 1984. And so I have seen and experienced and heard of way more homeopathic miracles than I could possibly count. Because in addition to all of my cases, all the patients that I've seen that we've put in our books, and part of my training as a homeopath was watching cured video cases. So I have seen thousands of video cured cases because people only present cases that pretty much have done well.
Right.
So, oh my gosh. Well, I'm going to start with just a really easy one. So for beginners in homeopathy, I think this will resonate. So I have a patient who also happens to be a friend. And this happened to her about 6 weeks ago. So she told me, I was painting the wall on a 3-step ladder. And this was somebody who was repainting because she and her husband had painted everything for a rental. And then there was a flood, water damage. So this is like phase 2. So she was there painting, she lost her balance and she fell on the cement floor and she hit her head. So this is, needless to say, terrifying. And so she said, the left side of my head took the hit. My body was twisted. She's been a patient of homeopathy for a long time. And she said, I, quote unquote, started sucking down Arnica 200C and then 1M. It was a homeopathic miracle. That's what she said. I'm fine. So anybody who has any question about homeopathy, just try Arnica, and you tell me that it doesn't work, because that's not going to happen. I had a story too. My finger, I have a 1-year-old golden retriever puppy, and she's great, but I took her to the woods the other day, and there were other dogs there. It was a play date, and she was pretty nuts. And so she really pulled on the leash, and my middle finger here on the right hand got somewhat tangled in the leash, and it was excruciatingly painful. So I knew it could have either been fractured or it could have just been sprained. And I started taking Arnica 1M. And with Arnica 1M, you don't need to take it often. So I've taken it twice in the past, and that was on Tuesday. So I've taken it twice, and and my finger it looked bruised, and you can see here, there's no sign of bruising or anything like that. Day by day, the pain has gotten, and the stiffness have gotten much better, and it's pretty much back to normal. And I was at the gym yesterday at Zumba. Excuse me, my nose is running because I went swimming in a pool this morning. So I knew that this older man there had been a doctor. And I said, "Hey, Tom, look at my finger. Do you think this is fractured?" And he said, "Move it for me." And so I moved it, and he said, no. He said, "It's just a sprain." I said, "That's what I thought too. Do you think I need an x-ray?" He said, "No." So in any case, that's another Arnica story.
Yes, so good.
Okay, so go ahead.
I have, I did a previous podcast with a lady, episode with a lady who got hit by a car as a pedestrian, and all she used was arnica. And she said it was amazing. She actually went to work that same day after she got hit, when she used arnica. It's so good.
Well, I had an experience long time ago, well over 30 years. I was a psychiatric social worker at the time, 40 years must have been. And I was walking across the street, and I didn't see that there was a car on the other side. I was crossing the street, and I went to my car, and this car stopped, and just before it hit me. And so I got into my car, and I drove about half a block, and this woman flagged me down, and she said, "Are you okay?" And I said, "Yeah." So arnica, one characteristic of arnica, people needing arnica, is they tell the doctor to go home. They say, "No problem, I'm fine." And so that I experienced that myself, and I did take arnica for that.
Yeah, I've experienced that too. I got in a car wreck, a bad one. My truck was totaled, and they said, "Do you need?" I mean, I was out of it. I don't know. I blanked out. I have a loss of memory of right after that time, and the ambulance came and asked me if I wanted to go to the hospital. I was like, "No, I'm fine. I'm fine." And I really thought I was fine. I just wanted to go home. And then my husband came to pick me up, and he was like, do we need to go to the hospital? I was like, "No, I'm fine." And then as we started driving home, I said, "I think I need to go to the hospital." And so we turned around. Yeah, I've experienced that.
So using the sensation method that I follow, I just want to mention that arnica is in the compositae family. And the compositae family is a family of injuries and feeling bruised and feeling injured. And just so people know, calendula is in that family. Chamomilla, which I'm sure many people who are listening have used chamomilla, and a number of other Bella's Perennis and a number of other remedies are in that family.
Yeah, so good.
Well.
Yeah, that's great. I love what you just said about this, and you use the sensation method. Do you want to tell us about that?
Well, I've used it since 1993 when I studied with my teacher, Rajan Sankaran. There's 8,000 remedies plus. Yeah. And so how in the world do you decide? It's one thing to give arnica for an acute, but I see people who have much more complex situations than that. And so there's got to be some way to differentiate, to organize those 8,000 remedies. And so the technique that I really like, the method, it's called the sensation method. And you think about kingdoms. Does somebody need an animal, a plant, or a mineral remedy? And then you think about, which plant, which, in that, you think about, once you have the kingdom, then you think about which particular member of that kingdom. And so the miasm, which that's a whole thing in itself, but the miasm is the degree to which one feels affected. Let's just say it that way. So that is one way to narrow down the remedies, to find the right remedy.
Nice. Thank you for that. So, I think you might know most of my listeners are students of homeopathy. And so they love to learn new ways and new things. So thank you. You're not, yeah.
Sure. So I'll share some cases with you. So this is a 34-year-old young man. He's a certified electrical technician. So I inherited this patient from my husband after my husband retired. And he started being treated by my husband at age 17. Now he's 34.
Wow.
And he actually heard my husband, Dr. Robert Ullman, on the radio.
Wow.
And that's how he found him. So he has always needed the same remedy, which is silica, which is it's not an unusual remedy. And he's very quiet. He's very thoughtful. And he says, and he was born with congenital cranial stenosis. And so that required surgery immediately. So he was impaired to a certain degree. And he said, there are times when it feels like a light switch is flipped. The whole thinking process goes out the window. When the remedy is working, focus is there. I can multitask, I can plan ahead. I'm much more present mentally. He takes a dose of the silica about once a month and has for years. Now, and I talk to him now once a year. Okay. Now, this is not typical. Usually I talk to patients, about every 6 weeks or so, talk to parents every 6 weeks. But I just wanted to share this. And I just talked to him last week. He said, after a dose of the remedy, I'm more able to connect things, to put them together. And this is somebody who has also been diagnosed with speech delay, sensory integration disorder. I never would have known that from talking to him.
Oh, yeah.
He said, without homeopathy, I end up somewhat zombified. It helps me about 95%. I would feel a little bit left behind without it, not up to my potential, like flowers for Algernon.
Wow. So
that's him.
Yeah.
So here's another 7-year-old child with autism spectrum disorder, as well as OCD, obsessive compulsive disorder, and ADHD. And I've been treating him for 6 months.
Okay.
He's sweet, but he has meltdowns, fixations, and he can't stand to have his hair or nails cut.
Yep.
And let me just see. And this is really, really interesting. At 2.5 years, he started flapping, rolling around on the floor. So there is a category of remedies called imponderables. Mm-hmm. And then there's also remedies such as the one that I gave him. I gave him homeopathic ultrasound. Cool. His mother had repeated ultrasounds during the pregnancy. Mm-hmm. And after that remedy, his communication is amazing. He's not bobbing his head. And this was at the 6-week follow-up. Wow. And at the 4.5-month follow-up, his comprehension and communication skills have dramatically improved. Wow. And his reading is great. Now, this is going to be a continued treatment. Mm-hmm. In other words, and I don't think ultrasound is not the only remedy he'll need. He'll need another remedy. Yeah. But I treat lots and lots of kids on the spectrum. And so needing all kinds of remedies with all kinds of results. Right. And occasionally, I don't use any routine prescribing, but occasionally I will give MMR. Mm-hmm. In addition to intercurrently with whatever constitutional remedy. So, but not routinely. I don't prescribe routinely. Okay. So here's another case. This is so exciting for me. So I live in a small town half the year in Washington on an island, Whidbey Island, Langley. And the other half of the year, we live in Chile, southern Chile, which on a farm, which is a whole other story.
Righty.
So one of my friends, longtime friend here on the island, referred a relative to me. And this was a 28-year-old young man who had a history of bipolar disorder. And
What-
I use bipolar, manic depression,
Mhm.
bipolar disorder. We used to call it manic depressive disorder.
Yeah.
And many years ago, I was a psychiatric social worker. And that's why I sought out an alternative. That's why I went into homeopathy, because I was so distressed by the side effects of the psychiatric medications. And they were terrible at that time. It was not unusual to have something called tardive dyskinesia, which means people shuffle, like they look like they're, 90 or something, and they walk around shuffling. Or there was something called torticollis,
Mhm.
which people got from the psych meds,
Wow.
and they'd go like this. And these poor people
Yeah.
were having these debilitating side effects. And so that's really what I worked on the Locke psychiatric ward, and it was just, it was devastating. So that's why I became a homeopath. So this case is very inspiring for me. So this young man, smart young man, he had his first bipolar episode in 2011. And I only started treating him last year, 2021. So he's a tall young man, 6'7", and he was all the way up to 270 pounds. My guess is that had something to do with psych meds. I can't imagine why otherwise he'd be up to 270 pounds. And then he went down to 170. His first episode was when he was 18. He took meds for a while and then he refused. And we're talking about a very kind, caring, gregarious, helpful young man. So in his case, he had a heavy-duty drug history, mainly cannabis, starting at 14, but also mushrooms, acid, lots of other drugs. Okay.
I was going to ask if you thought street drugs were a possible etiology of the bipolar.
Well, that's a good question. And one of the reasons I wanted to present this case, I've often seen this after heavy duty cannabis use.
Yeah.
I've often seen it.
Mhm.
And when he was manic, he didn't sleep. He wrote graffiti on the walls of the house. He thought people were after him. He didn't sleep for 48 hours. He had, and this isn't unusual, delusions of being a millionaire. He was paranoid.
Mhm.
He would dress really bizarrely. So I gave him homeopathic cannabis.
Mhm.
And this, in other words, he basically had a cannabis psychosis that drove him into this.
Mhm.
And he has done better and better. First, I gave him a different remedy, which was agaricus
Mhm.
made from mushroom.
Yeah.
But at the 6-week point, he hadn't gotten better. And then I switched, and the whole rest of the time, he has been on the homeopathic cannabis. And we're talking about very, very diluted. We're talking about 200 C potency, diluted 200 times 1 to 10.
Okay.
So we're not talking about cannabinoids that
Right.
people take. We're talking about homeopathy.
Yes. Thank you for that clarification for sure. And was he still using cannabis when you put him on the remedy?
He was periodically using cannabis.
Okay.
And I try to have people stop. People will not always stop.
Right.
But fortunately, the remedy should work anyway. And so over the past year, I work by Skype or Zoom. And so I see him. And he's just looked better and better and better. And normally it'll be his father, him, and his mother, because they're all together. And so this time, just steadily better. And he has a job. He's working as a cook. And this time, I promise you, I could not, if I were just looking at him and talking to him, I would not feel like there was anything abnormal with him. So he's gotten better and better. He has a steady job. And I just said this time, because it makes me emotional, because this is a life saved.
Mm-hmm.
And in fact, I ran into the relative at the movie theater recently, and she hugged me and she just said, oh my gosh. So I asked him, so how much of the old you is back? I didn't know what he was going to say. Mm-hmm. He said 90% to 100%.
Wow.
And then his parents were both there. How much do you think he's improved? How much do you think? And they said 90 to 95%.
Wow.
And so this is why I went into homeopathy. And this is a brilliant young man who his life would have just been wasted to a large degree.
Yep. It would. Yep. I see that a lot too with cannabis, heavy cannabis use, and then, followed by psychosis, and psychotic episodes. And I didn't know that until, maybe the last 10 years, I started seeing that. And I wonder if it had, so in your experience, has that always been a thing with cannabis, or has the cannabis changed?
No, I don't think the cannabis has changed. I've seen this a lot. And it's with, well, let me just share this. I gave a presentation about a year ago at the National Center for Homeopathy, and it was right during the pandemic. And the presentation was on bewilderment during the pandemic. And I showed videos and I showed all these indicators about how crazy the world has been. And everything from at the beginning when we stopped driving, and the flamingos came back to Mumbai, and the pumas came back to Santiago, the capital of Chile, where I live, and on and on and on. And then I played some really beautiful videos like "We Are the Children." Do you know that? Da 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 da, we are the children, which I could listen to all the time. So, and I presented a case. And it was a case of a beautiful man who before had Asperger, because I treated him when he was very, very young. And he is very idealistic, and he sees the world as this beautiful place. And then there's the disillusionment, and that's cannabis, because they really want everyone to get along. You can think of the flower children.
Yeah.
Of which I was one decades ago. And so for us, and for me still, the concept of war and the concept that people can't, really love each other and get along with each other is shocking.
Yeah.
And that is part of the cannabis state. And then they dissociate, even if they, even if they don't take the drug. There's a feeling of where do my hands end and begin, and there's a feeling of escaping through the top of the head. And I think that must be happening more and more, because this world is a very difficult place to live now. And I expect, and you don't have to have a cannabis history to
use the remedy. That's right. Mm-hmm. Yeah. I had just heard some instructors say, just once, to be very careful, or to not use homeopathic cannabis while the person was still using cannabis. So have you ever heard that or thought that?
I don't, it's impractical, and in other words, somebody who is really a pothead, you tell that person in order to be treated, you're going to have to stop taking, they're not going to do it. So, right. And the remedy will work anyway, but yeah, ideally, and I can mention here, that's only one, there are other homeopathic drug remedies too, but cannabis is so ingrained in our society. And I know people are very, very happy that now in many states, cannabis is so available. And one of the best things, I think, is, and I don't know why I'm even emphasizing this so much, but it, for example, we had a dog. We've had golden retrievers. We're now on our 7th, and it's a really helpful end of life remedy, because she had 3 weeks after diagnosis until she passed from cancer of the spleen, which is common in golden retrievers. And somebody suggested that to me, and there was a veterinary product that was made. And so the last 2 weeks, I just gave that to her daily. And I don't think she experienced any pain. And she died at home, and we didn't need to bring the vet out. And yeah.
Yeah, so good.
But there are other things, of course, like rescue remedy that and homeopathy that you can use instead of that. But
and Dr. Murphy taught me arsenicum album was a great end of life remedy too. Just, if they have fear about passing.
Yeah, it's true. Yes, it's true. And I gave that to my mother before she passed. And what I didn't realize at the time, again, this was a long time ago, is she had pneumonia and she was 89 and she was in the hospital. And I did not have experience at that time with conventional medicine when they give opiates at the end. And I didn't know that as soon as they started giving them, I gave her arsenicum before that. And I didn't know that as soon as they'd start giving it, she would virtually be gone. I couldn't, not dead, but I couldn't communicate with her. She'd be. So here's someone else. This is somebody who I treated. She was a friend originally, and then I treated her many years ago. And then she came back last year, and she was 58, and she had incapacitating night sweats. And this is extreme. She was so dripping wet and exhausted that she would sleep on towels.
Wow.
And she said, it just exhausts me. I feel like I'm drugged. I am bloated. My whole abdomen feels like it's filled with water.
Wow.
And it's really interesting because when I take a case, I have about an hour and a half, and I'm just listening to the person. And as Hahnemann says, not to be prejudiced, not to think, oh, this is just like that other person that I saw who needed X. No. And so I just try to be an open book, and I try to listen to the person. And I've got an hour and a half. And then there's a flow. And often by the end of the time, I know what I'm going to give. Sometimes I have to study the case. But this was really, there's an aha when it all fits together. I mean, that's one of the amazing things about homeopathy. So she said, I feel like my whole abdomen is filled with water. She said, I was working with young gymnasts who were training to compete. And I really cared about them. And I felt heartbroken. She was, I guess you'd call her a bleeding heart. She said, I felt heartbroken at how much they were mistreated. And she told me stories about how they would be performing with injuries. Wow. Because it was high performance. And their coaches wanted them to perform anyway. And she watched this over and over again, and it broke her heart. And even she told me the story about how when gymnasts called from some competition and was saying how much she was in pain, but she couldn't stop competing. So she said, I'm drenched. My hair is so wet that it sticks to my face. I feel boiling hot with the night sweats. So do you have any sense?
Boiling hot with the night sweats.
Right.
And and heartbroken.
Right.
So, and then having to sleep on the towels. No, I don't have one.
So I repertorized this case, and one of the remedies that came up at the top for really intense night sweats was phosphoric acid.
Okay.
Okay, so acids are about exhaustion.
Yeah.
And the classic picture of phosphoric acid is somebody who has diarrhea, they're losing all this water, they're exhausted. And what they really want is refreshing drinks. What they really want is carbonated, actually carbonated cold drinks, and they're guzzling that. And so she didn't have that, but she had the combination of the complete exhaustion, it had the night sweats, and the bleeding heart. And so I gave her, I think it was a 1M, and it worked almost overnight.
Wow.
And I talked to her 6 weeks later, and she said, I'm 100% better. Of course, not all my patients are going to be 100% better, but the symptoms are completely gone, even the remnants of them. I have no night sweats. I'm feeling more whole. That's interesting.
Mm-hmm.
I'm sleeping better through the night, and she has not needed another dose. And this has been maybe a year and a half. So of course it's not always like that. You know, these are homeopathic miracles,
Mm-hmm.
but it just shows what's possible.
Yeah.
And whether it's arnica or whether it's phosphoric acid or whether it's a rare remedy that yeah. So I mean, homeopathy will not harm. It's gentle. And the one other thing I want to say before you ask me any questions is homeopathy, we think the vital force is intelligent. The vital force really knows what it's doing. And given a chance, unless it's too far gone, it will heal.
Right.
I mean, a fever, why do you have a fever when you're sick? There's a reason you have a fever, because it increases the red blood cells and the red and the white blood cells. And there's a reason for all of this. And so I think conventional medicine has just they've lost the thread. Yeah. And we don't want to suppress the immune system. We don't want if avoidable, you don't want antibiotics, corticosteroids. I had a patient years ago, longtime patient. He called me from the Midwest. He sounded awful. And I said, you've got pneumonia. And it sounded bad. And I said, you need antibiotics right away. So it's not to say that there's no place for that.
Right. That's right. Yeah. Yes. I always encourage people to have discernment, within their families and themselves when they're trying to use homeopathy for themselves. And often, or even if I'm helping them with an acute, they'll ask me, do you think I need to go to the hospital? I can't usually decide that for you because I'm not with you, unless I see something big, like, what you heard. People have to have discernment, and if you're not sure, then get help. If you're not sure, go to the hospital and use homeopathy on the way. Maybe you won't even have to go in,
right?
But do what you have to do. Yeah, exactly. There's a time and a place for surgeries and antibiotics, but just not as often as we have been fed them over the years. And even surgeries, there's a lot of unnecessary surgeries, and people don't even know that homeopathy or other healing modalities can help them avoid surgery.
I'll tell you a couple of personal stories. So my husband, on his 50th birthday, we were going to have a party. He's 71 now. And so we had just gotten back from Boulder, where we were teaching homeopathy. He was really exhausted. And the morning of the party, where we were supposed to have the party, he was coughing and he was exhausted, and he really did not look good. So we canceled the party. This was a Saturday, and he spent most of the day in bed. And I said, let's see what happens tomorrow morning. And so I got up early the next morning, and I think it was like 2, and there was blood in the bathroom sink, and which is a sign of pneumonia, bright red blood. He was breathing quickly. And so I drove him immediately off island. We went to the ER, and the ER doc said he has bilateral bacterial pneumonia, and he would have been dead in 5 hours. On the other hand, when I was 50, I had breast cancer, and I had a mastectomy. And shortly after that, I developed a goiter. I developed which my mom had. And I developed a real swelling of my neck, and the thyroid gland, and they couldn't figure out conclusively what it was. They tried to do a needle biopsy. It was inconclusive. I was nervous because I just had cancer on that side. And so I decided to have half of my thyroid removed. And the endocrinologist said, well, you're crazy. Why would you want half of your thyroid removed? Because in a matter of time, you're going to be on thyroid anyway, because the other half of the thyroid is only for a certain amount of time going to be able to handle the burden. And so here I am. This is 24 years later. And I'm very high energy, and I've never had to go on thyroid.
Nice. And you did get half the thyroid removed? Is that right?
I did, because it was so large a goiter. I couldn't have lived with that. It was on this side, but it was too large.
Wow. Yeah, so they'll give these prognoses, and they don't really know. Of course they're saying what they think, but they don't really know.
So I don't believe in being foolhardy. I've seen some tragedies, including one that I just saw very recently, where a young woman in her late 20s had cervical cancer, and she was convinced that she could heal it herself, vegan diet, on and on and on and on. And she just died a week ago.
Wow.
So
there has to be discernment.
Yeah.
We have to, everybody's different. You have to decide.
And the other thing, I believe, I think from what I read about you, I think that you believe this too. There's a divine plan, and there's divine guidance. And so there's many, many different ways that plays out. And we really have to listen, and healing comes in many, many different ways. And healing comes through surgeons, and healing can come through medications, and certainly through homeopathy, and through healers of all kinds.
Yeah. So good. So thank you for sharing all of your knowledge and wisdom and your homeopathic miracles. This has been really nice. Did you share all of your cases and homeopathic?
Yeah, I just put together a few.
I love
it. So I did want to mention we did write 8 books on homeopathy. And the first one was The Patient's Guide, when we first started practice. But then Ritalin-Free Kids was in the late 90s. And this was, I think it was 96. And this was right when there was the Ritalin epidemic.
Yep, it sure was. I remember that.
So that changed our whole lives, because that led to not only to other books, including books on the autism spectrum, et cetera, but it led to us going all over the world really teaching, because we were the first ones who were talking about that at the time.
Wow. So cool. How can people buy your books? Where would we look?
They're on Amazon, or my website is healthyhomeopathy.com.
Wonderful. Healthyhomeopathy.com. Beautiful.
Yeah, and I do treat patients. I work virtually, and I treat a lot of kids, and I treat adults, and yeah, so I'm happy to help people.
Yeah, thank you. Thank you for sharing that.
You're welcome.
So nice to talk to you and meet you. And I hope that maybe we can do this again in the future and have a specific topic or whatever.
Yeah, it's just it's fun to share experience as we get older. That's one of our gifts.
That's right. That's so true. Just quickly, you said you used to be
Psychiatric social worker.
So that when you said that, what I felt in me was that experience. Of course, it's why you got into homeopathy, but that experience set you up and helped you to be a better homeopath also, because you have that experience. And so that's what's happened with me too. So I worked in the hospitals. I worked with children for almost 30 years. So
you don't even look old enough to do that.
Thank you. I'll be 50 in a week or two.
Wow.
So I started working with children very young. But all of my different experiences, my different jobs set me up to be doing what I'm doing right now.
Totally. My husband, the way he paid for I think it might have been his undergraduate, but it may have been in naturopathic college. He worked with developmentally disabled kids. And here he worked with so many kids on the spectrum. And that's a whole other issue. I mean, I can't tell you how much more common that is than it was when we first started practicing. And it's heartbreaking.
Yeah.
It really is. And those parents are my heroes.
Can you imagine how hard that is?
And multiple kids.
Yeah.
I mean, we're talking about, yeah.
Yeah, I agree. Those are amazing parents and I see them all the time, and I hear them talking to their children and just with this love and this beauty. They're not irritated. They're not mad. They're good. They really are good parents.
But I do want to make a comment here that they need to be treated too.
They do. They need help. Yeah, I agree. I agree. Yes.
Yeah.
Thank you so much. It was so nice to meet you.
You're so welcome.
Thank you. I'll look forward to talking to you again soon.
Okay. Take care and keep up all your great work.
Thank you. You too.
Bye.